After the surgery, we look at the surgery result. We also look at the surgical specimen, how big was the tumor, how many lymph nodes were there, and based on what we find in the surgery, sometimes we do further workup for proper staging. And based on the stage, either stage 1, 2, 3 or 4, then we try to decide the appropriate treatment for the patient. Stage 1, usually these are very small cancer, a small melanoma. They don't go anywhere other than the primary site. Lymph nodes will be negative. For this kind of staging, surgery is the treatment. If it is stage 2, means the melanoma might be a little bit bigger, or the depth might be a little bit more, and sometimes we also look at the pathology of the tumor and try to look whether there is any high risk feature in the tumor. If there is any high risk feature in stage 2 disease, then in some instances we may offer further therapy for that patient after surgical intervention. Stage 3 disease, basically these are melanoma with some form of lymph node, and this patient will need further therapy after surgery. And stage 4 disease is melanoma when we see that it has spread to the other part of the body or other organs of the body, then we call it stage 4 disease, and definitely those patients need further therapy managing their melanoma. Treatment options for high risk melanoma stage 2, and of course for stage 3 and stage 4, the treatment options are immunotherapy with interferon. This is widely used and most commonly used for high risk stage 2 and stage 3 disease. You initially 4 weeks, from Monday to Friday, you take an IV shot every day for 4 weeks. Then you can take the shot 3 times a week for 11 months. There is another new treatment option that just came recently, that is long-acting immune therapy or long-acting interferon. You take the induction therapy for 4 weeks, and after that, instead of 3 times a week, you can take a shot once a week. But of course the total duration is more than that. It is advised that if you can continue, you should continue that for about 5 years. For stage 4 disease, there are some options for oral pill and also some IV therapy. For oral pill, we have been using temozolomide for a long time with response rate about 15 to 20%. There are some new options that just came in very recently. One is called ipilimumab that you can use for stage 4 disease, and the other option is another oral pill that is a targeted therapy, and if a patient has a specific changes in the tumor that we can test for, and if it is positive, then we can treat those patients with oral pill twice a day with some satisfactory result. Patients who had melanoma, of course, the chance for recurrence of the disease or getting a second melanoma is very high. So we would like to follow these patients very closely. Usually after finishing the treatment, we like to see these patients at least every 3 months, first 2 to 3 years, with some imaging study and some blood work. And after 3 years, we like to see these patients every 4 to 6 months, and after 5 years, maybe every 6 months. And we also tell the patients that you should be seen by a dermatologist regularly.